Okay, this begins the postpartum lecture, and we're going to talk about the different assessments and the different teaching that you do in postpartum for this PowerPoint. So the postpartum period is the return to the sort of pre-pregnancy state, and the reproductive organs will go through different changes, and it lasts about 6 weeks. So in the postpartum assessment, to kind of organize your assessment, you'll kind of go through what is known as bubble pin. And we're going to go through each part of this postpartum assessment and make sure that you are aware of each assessment need in the postpartum period. So the main things we're going to look for postpartum is any kind of infection in the breasts or any other part of the woman's body. We're going to look for those DVTs that women are high risk for, leading to PEs, pulmonary embolism. And we're also going to look for excessive bleeding. Postpartum hemorrhage is a very preventable problem, and it's pretty you see it a lot. So we're going to talk about how to look for those kind of three things. So infection, any kind of clotting problems, and of course any kind of bleeding problems. So let's start. The first one are the breasts. So we're going to palpate the breasts, look and see how her milk production is coming. We're going to teach her that colostrum is that early milk, and it's filled with lots of nutritional needs for the baby. It has antibodies. It gives IgA to the baby. And this is milk that is produced by 72 to 96 hours after birth. Women can start producing colostrum in pregnancy, especially if this isn't their first baby. So colostrum is this clear kind of gold, we call it liquid gold, kind of substance that is perfect for brand new babies. So once the milk comes in, though, the women will experience engorgement, and this can be very painful because every milk duct is full at this time. And so we're going to teach mom to help with engorgement by telling her that taking warm showers, and in those warm showers, doing hand expression of milk in the shower to kind of relieve the pressure. She can also pump if she wants to, kind of lessen the engorgement or feed the baby. So we're going to look for mastitis, which is a clogged duct, and what causes mastitis is an improper latch or cracked nipples, and the staph infection gets into the cracked nipples and causes the infection. So the next part of the bubble pin assessment is the uterus, and we want to make sure that this uterus is nicely constricted and at midline. When it's firm, we call it contracted, and when it's soft, we call it boggy. So when we do find a boggy uterus, we're going to massage. We're going to do a vigorous massage called cradaying the uterus to get that uterus contracted. So we're going to place one hand above the pubic symphysis and the other hand on the fundus to kind of get the uterus between the two hands, and we're going to start massaging. So when we assess the uterus, we're going to determine the position of the uterus, and we're going to use our finger, they're called finger breadths, to measure the distance between the fundus and the umbilicus, because the uterus will first be above the umbilicus right after delivery, and then it will be in line with the umbilicus, and then we'll go down 1 finger breadth per day until it disappears into the pelvis or below the pubic symphysis. So 1 finger is approximately 1 centimeter. That's what that means there. So a boggy uterus just kind of tells us that the uterus is not contracting those those uterine arteries. And when it's contracted, it's constricting those nice, large uterine arteries. It's a cause of excessive blood loss and hemorrhage. So, like I said earlier, the nurse will immediately massage the fundus and do it in a circular motion. So all of our postpartum, and I believe every woman in Utah, even if they're not on Pitocin during the labor stage, they will be given Pitocin postpartum just to ensure that that uterus is nicely toned. So here is a YouTube video you can click on to, I'll probably post it, I'll post this on your module to show the uterine massage. So this is what I mean by finger breath. So at delivery, the fundus should be at a little above the fundus. It should be midline and it should be contracted. And then the fundus descends 1 to 2 centimeters every 24 hours after that. So at 12 hours, it will be 1 finger breadth above the umbilicus. Then at 24 hours after birth, it will be 1 finger breadth below umbilicus. And then day 2, 2 below, day 3, so on and so forth, 3 below the umbilicus. So how we do our uterine assessment is we want to make sure that that patient is supine. So we'll lower her all the way back. Now we're not worried about the hypotension because of the gravid uterus anymore, so the woman can lay supine at this point. We want to make sure she has an empty bladder. A full bladder will cause the uterus to be shifted either to the right or the left. We want it to be midline. So if we do find a constricted bladder that is either to the right or the left, we will have her empty her bladder. We're going to assess for the location and tone of the uterus. And we're going to do it very often right after birth. And then we're going to do it less often the more she is showing signs of a normal assessment. So at 8 hours, we're going to do it every shift. Sorry, at 4 hours, we're going to do 4 hours for the next 24 hours. And then once she's 24 hours, then we're going to do it every shift after that first day, that first 24 hours. And then if we're having abnormal assessments, we'll assess her more often. So with when the baby is delivered and we want that baby to be, or that we want the uterus to be nicely contracted, we can have the mom breastfeed, which will cause uterine contractions, which are constricting. They're called after pains. And when she breastfeeds, it releases her endogenous or internal oxytocin, which keeps that uterus nicely constricted. That's one of the reasons why we want the baby at breast right after delivery. So those contractions after delivery are called after pains. And they're intermittent contractions. They resemble menstrual cramps. And when a mom has only had one baby, her uterus is pretty well contracted, and so she will feel less after pains. The more children a woman has, the more she'll feel those after pains, because her uterus, or if she's had twins or triplets, or the more that uterus is being stretched out, the more she will feel these after pains. And then they resolve typically within 3 to 7 days after delivery. So let's talk about the causes of a boggy uterus. The overdistension caused by too much amniotic fluid volume, more than one baby in the uterus, more than one fetus. If she's had lots of babies, if her labor time has gone on for a long time, it'll cause that uterus to be boggy after delivery. If there's any products of conception left behind, parts of the placenta, anything that's left behind will cause that mom to continue to bleed and will cause her uterus not to be constricted. Any kind of difficult labor and delivery, an infection, and also a full bladder. So the next part of our bubble pin assessment is the bladder. We are going to inspect and palpate that bladder. We are going to talk about the woman about wiping front to back, other perineal care. And we want to make sure that she is urinating frequently and that she's able to urinate on her own. A woman who has had a C-section will have that catheter in place until she's able to move around on her own and we get her up to the restroom. We want to teach her any signs and symptoms of a UTI. So we're going to teach her that frequent needing to void often with or without pain or burning may indicate an infection or that she's having urinary retention because of that atonic bladder caused from the trauma of birth. We're going to assess her bowel function. So we're going to question her every day if she's had a bowel movement, and we're going to listen when we do our daily assessment or the 4-hour assessment. We're going to listen to her bowel sounds, watch for constipation. We'll give her stool softeners. Those are usually prescribed by the provider. And then we're going to teach her about hemorrhoids. So a lot of women will have hemorrhoids postpartum. And like I said, it's the same kind of care that we teach for any sort of incision. So apply ice right after to reduce swelling, and then sitz baths. We're going to give local analgesic, which is the witch hazel spray that we can offer them, and like I said, stool softeners. We want to make sure they stay hydrated, not only to keep her breast milk supply enough for her baby, but also constipation will aggravate hemorrhoids. And then we're going to teach about lochia. Remember, lochia is not just the bleeding afterwards, but the entire endothelial inner layer of the uterus will be shed. So all the epithelial cells will be shed. And that's also what's part of the lochia. So it's the bleeding caused from the detachment of the placenta from the uterus. So that is an open wound, but also the uterus is shedding its entire endothelial layer, just like what happens every month with a period. So it should be small, bright red, moderate amount with small clots. And it will have a musty or stale odor, kind of just like the smell of blood. A little bit different, but close to that. And it's similar to a heavy menstrual period. And then it's going to steadily decrease as the days go by. We're going to assess her bleeding every time we assess her uterus. And we're going to massage the uterus to see if we're going to release the extra blood every time we're doing a fundal check. And then we're going to check that peri-pad to see how quickly it's being saturated. In the lab, I showed you that these peri-pads are large peri-pads. If they're saturating that peri-pad rather quickly in less than an hour, then we know that she has a risk of postpartum hemorrhage. And we're going to start qualifying or measuring, weighing to see how much loss that she has. And then we're going to put her on a postpartum hemorrhage protocol. And I'll go over that in the next slide. I'll show you a whole slide. I have the University of Utah's postpartum hemorrhage protocol, and I'll show you kind of what that looks like. Each hospital has their own postpartum hemorrhage protocol, but the University of Utah has a really great one. So I'll show you that later. So let's actually stop this video and we'll continue with lochia rubra on our next video.